Countries around the world have shut down to curb the spread of the coronavirus. But in South Korea, people are starting to come back out on the streets. Starting in late February, South Korea was reporting a sharp increase in coronavirus cases. With over 5,000 infected, they were registering some of the highest numbers of confirmed cases in the world. But then something changed. While cases in most other countries continued to rise, Korea's numbers started leveling off. Look at how this curve starts to bend. It indicates that Korea managed to contain the spread of the virus early on. And they were able to do it because they learned a valuable lesson a few years ago, when they fought a different coronavirus outbreak.
In South Korea, the Middle East respiratory syndrome,
the death toll on the rise, aggressively trying to contain the deadly outbreak.
The government was caught completely off guard.
Authorities are still trying to track down and isolate anyone who may have been exposed.
In 2015, a Korean businessman returning from the Middle East developed a fever, a cough, and eventually pneumonia. He went to several health facilities for a diagnosis before finally testing positive for MERS, or Middle East Respiratory Syndrome, caused by a coronavirus. By that point, his movements had created a chain of transmission that became hard for officials to trace. They didn't know who was infected or where they had been.
It lasted less than 2 months, but it was a big panic in South Korea.
Altogether, the virus infected 186 people and killed 38 in South Korea, the highest of anywhere outside of the Middle East. The government declared an end to the outbreak in 2015.
Citizens can relax. The virus no longer poses a threat.
But they didn't stop planning.
We got many lessons learned, the importance of the diagnostic test, and we need basic infection prevention measures.
The lessons all came into play when the next outbreak took hold in the country. On December 31st, 2019, China reported the first case of the coronavirus. In the following weeks, as the outbreak started spreading across the world, South Korea only had 30 confirmed cases of the virus. But despite the low numbers, health authorities had already started working with biotech companies to develop a test for the novel coronavirus. And soon, they had thousands of test kits ready to go.
Lesson learned from MERS outbreak in 2015. First one is the diagnostic test is very essential. We developed a lot of diagnostic tests and distribute in every hospital.
They prepared for the worst, and the worst quickly followed. By late February, the total number of coronavirus cases rose dramatically, crossing 3,000. This made South Korea's outbreak the largest outside of mainland China. And it all started here, in Daegu, where a woman went to the hospital with a fever. Because the government had already equipped hospitals with coronavirus tests, doctors were able to test her. She tested positive and became known as Patient 31. But the testing didn't stop there. While she was sick, Patient 31 had gone to a megachurch where she sat with a congregation of hundreds for more than an hour. So they traced her movements, identified people she had come into contact with, and then tested those people as well, whether they showed symptoms or not. Many of them also tested positive, so they were quickly isolated and treated at home or at a center. And then all the people they had been in contact with were traced and tested too. This is called contact tracing. It's an approach that allowed Korea to test over 9,000 people who had been in contact with someone who had tested positive. After Daegu, Korea ramped up testing around the country. Private and national healthcare systems joined forces to set up a mostly free testing effort that includes more than 600 locations that screen as many as 20,000 people per day. Through this system, when anyone tests positive, the government is able to test and trace their contacts to continue to break the transmission chains of the coronavirus on a large scale. But that's just the human-to-human transmission. The infected person may have moved through the city, touching subway poles and door handles. and South Korea had prepared for this too. After the MERS outbreak, when they weren't able to trace the movements of the virus, Korea changed the law, allowing the government to collect a patient's data and security footage during an outbreak. All their steps are logged and then shared to alert people to stay away from the path of infection.
If there is some confirmed case found near my office, they message via smartphone, there is a confirmed case near your place. He moved some place to another place. Be cautious.
Websites and private apps compile that information, allowing everyone to see if a person with a confirmed case of coronavirus went to a pharmacy or the hospital or anywhere else. And they'll know how recently they went too.
It's a means of checking the possibility of infection.
Citizens are checking the coronavirus locations and are avoiding going to these areas.
This information lets people know if they've crossed paths with an infected person, so they can go get tested for the virus. And contact tracing starts all over again. Tracing people's every move can be controversial, but many in South Korea prioritize public health over privacy in an outbreak.
남에게 전염시켜줄 수 있다는 그런 특성 때문에 개인의 인권보다는 공익적인 그런 요인에 대한 걸 많이 강조하는 그런 경향이 있는 건 사실입니다.
As a result, South Korea was able to test hundreds of thousands of people, more than any other country at the time. And this made it easier for authorities to see the virus, to see where it's located and where it may be lurking. This ability to find and treat infected people has allowed Korea to avoid aggressive lockdowns. And it's helped bend the curve of the outbreak that started out dangerously steep. For now, Korea has turned a corner, but they continue to be prepared.
We are very cautious to prevent the second wave. Every day is the kind of state of war.
It's that kind of vigilance that has set Korea apart in the coronavirus pandemic. But it wasn't the only place to test people aggressively. Singapore, Taiwan, and other neighbors saw the benefits of widespread testing too. Now countries like Germany and the UK are starting to implement aggressive testing, and even the US, where the government has failed to provide adequate testing, is now scrambling to test more people.
We know that we have to do more, and we continue to accelerate in testing.
Korea's strategy of contact tracing might not be easy to replicate in countries with much larger populations. But the country's success with widespread testing still offers a way out for most countries that are stuck in lockdowns.
It was a new virus. It spread to humans, and it could spread fast. I assumed the idea of doing nothing to get herd immunity also crossed minds, because that will minimize the economic impact and social disruption. But what about the toll on lives? How many people have to die to have social immunity? And China has a large population, needed to do something, big and quick. We went back to the basics, testing, isolation, and contact tracing. But that proved to be challenging. If you have enough testing kits and trace contacts thoroughly, you don't need to isolate everybody. That is what Singapore and South Korea did. But in the beginning of the outbreak, Wuhan did not have enough testing kits and could not trace everybody. So the Chinese did the extreme. Wuhan was locked down. People stayed at home. The lives of millions were disrupted, and the economy came to a halt. A month later, the epidemic was under control. Blinded by stereotypes like how we can trust information from a communist country, you are not only doing injustice to the painful efforts of the Chinese, you are denying yourself a chance to gain insights into a common enemy that respects no national borders and political inclinations. Let us not be provincial here. Some of the ideas and practices might not apply elsewhere, but it won't hurt to listen. Isolation means isolation. It needs compliance from the people. China underwent a period in which the government moved infected patients and even their close contacts from their homes and put them in strict quarantine. That is extreme. But that also dramatically cut down infections. People think of the Chinese as disciplined, but what I saw in Wuhan was beyond normal discipline. Nobody stayed indoors because their apartments were blocked by metal bars. They stayed at home because they commit to each other.
I must give the British people a very simple instruction. You must stay at home to slow the spread of the disease.
Never in peacetime have we seen anything like it. This is the story of Britain's first 2 weeks living in lockdown.
One of the key aspects of Chinese policy was lockdown, and you have a well-organized response to earthquakes and all sorts of national disasters. And when the epidemic came along, the people who organized responses to national disasters were already well organized. We will play our role with China in the global response to this virus. It is a global problem. It's not a national problem. And China is leading the global response, providing a lot of equipment and a lot of help to countries around the world. But for us, the Italians, the Spanish, we're not as well prepared as China in dealing with national disasters. And we're learning very fast.
Is South Africa's slow rate of new infections an indication that the national state of disaster measures are impactful, or is it more complicated? The country currently has 13 deaths and 1,749 infections, which is lower than the 6,000 cases that were expected. As part of the measures to flatten the curve of new infections, the country has also rolled out a mass screening and testing program. Professor Shabir Madi, who is a vaccinologist at the University of Witwatersrand, now joins us on the line. Good evening, Professor, and welcome to The Full View. First of all, starting off with the introduction to our interview, the question is this an indication that the measures that have been put in place are actually yielding the results that government had hoped for?
So good evening to you. So the short answer is that it's really difficult to tell exactly what is happening with the circulation of the virus and how many people are infected in South Africa. What has happened since the start of the lockdown is that the number of individuals that have come forward for testing has actually decreased rather than increased. So there's fewer people that are coming forward for testing, and consequently it's very difficult to understand whether the sort of slower rate in terms of the day-to-day increase in number of cases is because of fewer people being tested rather than because of the circulation of the virus having been sort of dampened. But with the lockdown itself, what we do expect is that there would be dampening of the circulation of the virus in the community. So the lockdown will have some effect on that, but the problem is that once the lockdown is lifted, unless we've been successful in identifying the infectious cases and isolating them during the period of the lockdown and quarantining the immediate contacts, we risk a major rebound in terms of the number of cases.
Today we came to unveil a number of mobile laboratory test vans. The NHLS has procured 60 mobile vans in addition to the 7 that were currently being used, and therefore it brings us now to 67 mobile testing units in the vehicles which are equipped as laboratories. We should indicate that 44,202 people have been tested, largely in the private laboratories. This, for us, is way too few for the size of population and the inequality, poverty, and underlying burden of diseases and immune suppression that we have. So even though this number seems high, I'm saying it's still far, way too low for the kind of challenges that South Africa faces.
81 miles from China, Taiwan only has 282 confirmed cases. What did Taiwan do right?
Taiwan, South Korea are perfect examples of doing testing immediately.
The best healthcare system in the world in Lombardy is now collapsing. Will the US become a second Italy or worse?
To me, you have to crash. You have to shatter the curve.
Can lives and the economy be saved at the same time? What about one place that most successfully contained the outbreak? What did Taiwan do to keep the CCP virus in check? In this episode of Zooming In, we look at facts and numbers, and we discuss these questions with some of the finest minds in the country. This is the city of New York, the cultural, financial, and media capital of the world, now as quiet as a remote rural town. As of April 1st, there have been at least 83,712 confirmed cases of the coronavirus or CCP virus discovered in the state of New York. Taiwan has kept the CCP virus in check. What did Taiwan do right? As of March 28th, Taiwan, an island 81 miles off the coast of China, has reported only 282 confirmed cases and 2 deaths. Life in Taiwan remains essentially intact with only large events being cancelled. Business, restaurants, and schools have stayed open. Experts say that Taiwan's results are largely due to its early response, at a time when the rest of the world seemed to be looking the other way. On December 31st, when Chinese officials notified the WHO of a mysterious pneumonia emerging in Wuhan, the Taiwan CDC began monitoring passengers arriving from Wuhan on the same day. On January 5th, anyone who traveled to Wuhan in the previous 14 days were screened. On January 26th, Taiwan became the first country to ban flights to and from Wuhan. It eventually banned all Chinese visitors on February 6th. Since identifying its first patient in January 21st, the government has implemented 124 safety protocols. Among them is a big data tracking mechanism. All people screened or quarantined for CCP virus in Taiwan are monitored by the government through a mobile phone tracking system. If these people leave home, their phones will send a message to the local police department and the disease control center. They will also receive an alert on their phone that tells them to go back home. South Korea, Singapore, and Hong Kong also tested widely for the virus and quarantined suspected cases. South Korea's curve has recently flattened. Singapore and Hong Kong have not suffered a significant outbreak.
Taiwan, South Korea are perfect examples of doing testing immediately, doing social distancing, right, immediately. And they, through their action of the government, through local official, and basically the people who can govern themselves, showed you that you can put this, you can get this virus and back you. Now, I hope it continues on in Taiwan. They continue to be very vigilant, but also using the malaria drug. So I think there in Taiwan, you saw action that had an impact, and in Italy you saw people trying to wish it away, and it didn't work.
By installing the early travel ban, performing early testing, and using a big data tracking system, Taiwan has been able to locate where the virus is and therefore target it precisely. Can the rest of the world borrow Taiwan's experience? It might be hard for countries like the US to use big data tracking, since it brings up the question of individual rights that we hold dear. Also, the United States has long passed the time of early prevention. Taiwan started screening Wuhan travelers on December 31st. We are close to 4 months past that. So what can we learn from Taiwan's success then? I think what we can learn from Italy's failure and Taiwan's success are essentially the same. Either you get control early, or it definitely gets out of control later.